Which ball should you use to release your hip flexor muscle? This is an important question that I get asked all the time, and it's a very important one. A lot of people feel as though if they use a lacrosse ball that they can get at their hip flexor. And the reason they experience that is because when you do lie on a lacrosse ball or something this size, you do feel a sensation which feels like tension in your muscle. But if you look at this model, this is a skeleton with all of your organs taken out. Here's the front of your pelvic bone, and here's that hip flexor muscle you're trying to get to, your psoas muscle and your iliacus muscle. Both of them are very important. If you imagine your abdomen is coming up here, right? I'll show you from the side. Your abdomen kind of comes up here. Depending on how much adipose tissue you have in there, it'll be bigger or smaller. And then if you use a small ball like this on that tissue, you're really only going to get about this far in. You know, from the side, you're really only going to get to maybe close to the psoas, maybe close to the psoas. And maybe some of your tissue that's between the ball and the psoas might gently push on the psoas, but it's not very specific. It's really not designed to get deep enough. Really what you need is something that is 4 inches in diameter. And believe me, I've tested all kinds of balls at all kinds of diameters. This is the perfect size so that when you do lie on it, it has enough distance from the floor to actually push on the psoas muscle. Otherwise, if it's not big enough, again, you're not going to be able to get deep enough. So this is the ideal size, 4 inches. You can use a softball, but a softball is very, very hard. And this muscle, oftentimes when it's tight, is very, very tender. Happy muscles don't hurt. And when this muscle is not happy, it's going to be tight and painful. So using a softball oftentimes is not very comfortable. So using a ball that's a little bit soft, but still has some firmness that is 4 inches in diameter is ideal. And then putting that pressure on that muscle will work. So it's super simple. I'll just demonstrate it really quickly. You take a big ball like this, 4 inches, find the edge of your pelvis where the bone sticks out, place the ball right inside there, roll over on your stomach. Ta-da! Oh, feels so good.